And also for the fact that somebody can live with the virus for a very long time without showing any sign. You can't use appearance to tell who is having the virus and who is not. So there is no problem with this health condition, HIV. Hello viewers, my brief discussion is on the topic HIV or AIDS. I would like to begin by saying some of us love to say, oh, as for me, I don't like condom. Some of us boldly say, I don't like condom, I want it raw. Some of us proudly say they want skin to skin. They do not like the use of condom, they want it raw. Please, if you are one of those people, then I want you to pause and reflect. There is no problem with HIV today in terms of treatment. The biggest problem of HIV today is stigma and discrimination. So if you are a lady that you do not like the idea of using condom, please, I want you to pause and reflect. If you are a guy that you enjoy saying that you do not like the use of condom, then I want you to pause and reflect. The biggest problem, again, with HIV today is not its treatment or management. The biggest problem of HIV today is the stigma and the discrimination that is associated with it. Do you really want to be taking pills, HIV medication for life? Do you want to continue going to the hospital to get HIV medication on a regular basis? These are some of the questions that you need to ask yourself. If you are one of those people who is not careful to protect yourself against this HIV infection. Sometimes somebody lives in Accra, all right, and the person is forced to travel to Kumasi just to go and take HIV medication. The person lives, let's say, in Kumasi, and the person will travel to Accra just to take HIV medication. The question is why? It is simply because of stigma and discrimination. He or she does not want others who know him or her to see that he is going to take the medicine or to see that he has the HIV infection. So today there is much improvement in terms of treatment of HIV and the management. But the main problem with this health condition is the stigma. So if you do not want to walk around looking over your shoulders as to whether who knows that you have the virus and be hiding, then I want you to think again if you are one of those people who is not very careful to protect yourself against this virus. Ladies especially are more at risk of contracting this HIV virus because of their anatomical features. Ladies, receive, when they engage in sex, they receive fluid from men. So ladies have greater risk of contracting HIV than men. So it's very interesting when I hear ladies who openly say they do not like the use of condom and that they want it raw, they want skin to skin. That is very interesting. If you are a lady, you are the one who is supposed to be at the forefront, preventing any man from having sex with you when you do not know the HIV status or when you doubt the HIV status. I'll also say again that if you are dating any lady or you are dating any man, if he or she refuses to have his or her HIV status revealed or tested for you to be convinced, do not engage in sexual intercourse with that person. If you are going to marry even and your partner refuses to have the HIV status checked, please do not agree to go ahead with that marriage, because you might put yourself at risk of contracting the virus. The question is why? This is it. Over the years, so many years ago in the 80s, when the disease started, there was no treatment. But today, we have treatment, all right, where people can be on treatment, they live their normal life, they do not experience any health problem relating to the virus. They don't have any signs and symptoms associated with the virus. And some of them who do not follow the management or taking of the pills properly, they still go on and infect others. So HIV in itself is not really a problem today. The problem of HIV today is the stigma. So if you are not ready to deal with the weight of stigma that is still attached to this virus, I will encourage you to always take steps to protect yourself from getting this virus. Somebody can live with HIV virus for years, 10 years, 15 years, 20 years, without showing any clear signs and symptoms. You see, HIV in itself, I would say, does not kill. HIV, the only thing HIV does is to, attack the immune system. The disease-fighting elements in the body, the immune system. Once it attacks the immune system becomes vulnerable, where other opportunistic diseases, easily, engage and attack the person. All right. So when you come to the hospital, people who die of HIV or AIDS, they normally die, by getting some of these conditions like TB and abdominal, problem. All right. These are some of the things that happen with HIV. HIV or AIDS does not kill directly. So until somebody gets to that stage where the immune system is destroyed, there is no way you can look at the appearance of somebody and say he or she has the virus. So that stage where the immune system is attacked and destroyed by the virus is what we call acquired immunodeficiency syndrome, and that is AIDS. So HIV is not a problem. The problem is the advanced stage of the condition, which is the AIDS, acquired immunodeficiency syndrome. The immune system is deficient, and that is when the person begins to show clear signs and symptoms. So people do not really talk about their status. People really do not discuss HIV today, simply because of the stigma and the discrimination that is associated with it. Today, I would say, when you compare treatment, in terms of treatment, HIV and AIDS and condition like diabetes, where people easily open up. Somebody can easily tell you, I have diabetes, I have hypertension, but nobody dares say, I have HIV. Nobody dares to do such a thing, and it is simply because of the stigma. So I would say, in terms of treatment today, HIV patient is far better than somebody who is living with diabetes. I know what I'm saying. When somebody is having diabetes, there are strict rules and regulations guiding the management of diabetes. But HIV, the only burden is for the person to adhere to the treatment, to adhere to taking the medication. And the biggest burden, which I think is what compounds effort to reduce the rate of infection, is the stigma that is attached to it. So if it is made possible for people to easily talk about the condition, it is possible for a man who is approaching a lady to say, he or she has the virus, he or she is living with HIV, but the partner having the right knowledge that somebody who is on treatment properly cannot infect him or her, may agree to go ahead with the marriage. There are people who are married, one partner is positive and the other is negative. They are married. The only thing they do is that the infected person adhere to treatment where the virus is no more located in the blood system to be transmitted. So they engage in sex, they have all the sexual interaction, and yet the partner who was not infected will still not be infected. That is the great achievement in terms of the management and treatment of HIV virus. The biggest problem of this health problem today, as I see, is the stigma. So if authorities, if our leaders really want to control the rate of infection of this health problem, they have to channel their energy and attention on the stigma, in dealing with the stigma. That is the biggest problem. If you undo the stigma and the discrimination, people will now freely talk about it. So if you are a young person listening to me at this very moment, do not look at appearance. Don't see anybody, a man, he's very rich. The man is very rich and he looks handsome and well built, and so you open yourself. You open, excuse me to say, your leg for him to have sex with you, because you will never think that, looking at his stature, you never think that he could be harboring this virus. But you might be wrong, because of treatment, effective treatment. And also for the fact that somebody can live with the virus for a very long time without showing any sign. You can't use appearance to tell who is having the virus and who is not. So there is no problem with this health condition, HIV. The biggest problem is the stigma and the discrimination. And it started when the disease first came up, where there was no treatment, there was confusion, misinformation. All right? So I will encourage you and urge you to always protect yourself. If you want to date, you are dating anyone, please, I'm not saying you should walk about with that kind of mindset, with that kind of paranoia, that's not what I am suggesting, that you should walk around with that. But anytime you are going to engage anyone sexually and you are not sure about the HIV status, please make sure you get more careful, you become more careful in handling such a person sexually. Do not continue to engage in sexual activity or sexual, specifically intercourse with anyone, any partner whose HIV status you do not know. So the secrecy, the shyness and the shame associated with the virus is what is hiding, what is making people to hide their status, is what is making people not to be willing to have their HIV status checked. And that is what is driving the rate of infection, the increased rate of infection in the country. And the government must focus attention on that. If it will be possible, the government can, make the testing of HIV or AIDS available for people to do at home by themselves. The testing kit should be made available so that people can carry them to the house and check whenever they like. They wouldn't have to go to the hospital and be scared of others knowing their status. That if that is possible, then the government or those placed in charge should make effort to make that possible. And people should also be educated that because of the effective treatment of the virus today, when somebody is exposed to the HIV virus within 72 hours, we call something pre-exposure prophylaxis treatment, where the person can be given treatment, medication to clear the virus within 72 hours before it takes root, before the infection is completely established. So when people, are no more scared, people are not shy, people are not afraid of stigma, and they openly talk about this health problem, it will help. Let's say somebody, a guy who is HIV positive, engage in sex, maybe let me say by mistake with a lady, because of the undoing, because of the removal of the stigma, the guy can quickly tell the lady that, oh, I had HIV, or I'm living with HIV, so go to the hospital and have this pre-exposure prophylaxis treatment. So you see the importance of undoing this stigma, removing this stigma associated with the virus. It is very important, and it is going to help a lot. So without talking much, let me stress again, there is absolutely no problem with the treatment of HIV. We are even at the point of cure of the virus. The problem of HIV today is the stigma, the stigmatization, the discrimination that is associated with it. So if you know you cannot handle the stigma, if you know you do not have the means to travel, you live in Navrongo and you have to travel to Kumasi to get HIV medication, if you know you will not have the chance to travel, you live in Accra and go to Kumasi or Takoradi just to take your HIV medication. Why? Because you don't want people to see that you have the virus. Please protect yourself always. Protect yourself always. You cannot determine who has the virus by looking at appearance. She may be very beautiful. She might, have her body in shape, everything. But that lady might be harboring HIV virus. So do not look at appearance. Guys, do not look at appearance. Her beauty may not shield her from the virus. How handsome he is may not shield him from the virus. So these are the things that we need to pay attention to. When you go to other developed world, they have spent so much money. Last time I read, America spent $20 billion, and most of that money goes into preventive efforts, where people are educated, where pre-exposure prophylaxis treatment is available. People get to know better and they find better ways of protecting themselves. Let me also add that in Ghana, when the statistics comes out, it shows that more women are having the virus than men. But I can say that report might be false on the ground. My reason being that, you see, here in Ghana, people don't like to know their HIV status. But when you are a lady and you are pregnant, when women are pregnant, at the antenatal units, they are forced to check their HIV status so that mother-to-child prevention can be ensured. So you have a lot of women who get their HIV status checked because they are pregnant. But men do not get pregnant, and so they don't go for anyone to say, let me check your HIV status because I want to protect your baby or your unborn child. So such kind of testing in women by virtue of they getting pregnant will be the reason why more women are being tested and less men are being tested. More women are being tested and men are not really being tested because they will never go to the hospital unless they are seriously aware other treatment is not helping, and a doctor will be like, okay, then let me check the HIV status. Because HIV is one condition that restricts treatment, responding to treatment, other infection. When other infections are being treated, HIV makes sure that the immune system does not help the person. So if the patient is not responding to treatment, the doctor can opt to have the HIV checked, and that is when men do not have option. So if you are a man, do not be happy that a lot of more women are having the virus. No, it is not true. It is simply because it could be that more men are having the virus, but just that they are not being tested. Thank you very much for your attention, and I hope you have learned something. If nothing at all, do not engage in sex with any man or any lady whose HIV status you do not know. If you are going to marry, make sure the two of you check your status. So I will encourage you also to adopt that kind of mindset so that you can protect yourself all the time. Thank you very much for your attention, and I hope you will share this message so that others can also learn a thing or two.
Thank you.
Subscribe and follow us.